Hey everyone, and welcome back for another deep dive. Today we're tackling something super important, but people don't often talk about it. Vaginal discharge. Let's be real. It can feel a little awkward to talk about, but isn't knowing what's going on with our bodies key?
Yeah, for sure. You got it. It's all about body literacy
Hmm.
and, feeling empowered to understand what's normal and what might, need a little extra attention.
Exactly. We've got some great medical guides on women's health lined up, and honestly, I learned a ton going through them. So our mission today is to help you figure out the difference between normal discharge and the kind that signals something might be up. Plus, we'll cover some common causes and when it's time to call your doctor.
Sounds good. Ready to decode the mysteries of vaginal discharge.
Let's do it. Can we just acknowledge that having vaginal discharge is totally normal? It's not something to be embarrassed about at all. In fact, the sources really emphasize that it actually plays a crucial role in keeping things healthy down there.
Absolutely. Think of it as your vagina's own cleaning crew. It's made up of cells, bacteria, mucus, and water. And get this, the vagina has its own microbiome, just like your gut.
What a microbiome. I've heard that term a lot lately, but I never really thought about it applying to,
Well,
you know.
yeah, it's true. And just like in the gut, the balance of bacteria in the vagina is super important for overall health.
So if we're seeing discharge, that means our vaginal microbiome is working its magic.
Exactly. Now, normal discharge can vary a bit. It can be white or clear or even a little thick, but it usually shouldn't have a strong odor. And here's where it gets interesting. The amount and consistency can change throughout your menstrual cycle, pregnancy, and menopause.
Oh my gosh, yes.
Huh.
I remember freaking out when I first noticed my discharge changing consistency during my cycle. I thought something was seriously wrong, but after doing some research, I realized it was totally normal
Mm,
and just part of how our bodies work.
right. It's pretty amazing how our bodies adapt to different hormonal fluctuations, right? These changes are usually nothing to worry about unless there are other unusual symptoms.
Okay, so we've got the lowdown on what's considered normal.
Yeah.
But what about when things go a little haywire? When does discharge become a sign that we need to pay attention?
That's a great question. And it's where things can get a little tricky. Abnormal discharge usually involves changes in color, texture, or smell. Think colors like gray, green, yellow, or even bloody discharge. Those are all red flags. Also, if the discharge gets foamy or clumpy, like cottage cheese.
Okay, that cottage cheese comparison is definitely going to stick with me.
It's definitely a vivid image, right? And it's often associated with yeast infections. But the key takeaway here is that any significant changes, especially when combined with other symptoms like itching, burning, pain, or swelling, should prompt a visit to your doctor.
So it's not just about the discharge itself,
Mhm.
but also any other symptoms that come along with it. Makes sense. Now, what are the usual suspects behind these changes? The sources mention infections, but is there anything else we should be aware of?
You're right, infections are a major cause, including yeast infections and STIs. But it's not always about infections. Sometimes it's just irritation from everyday products, like soaps or feminine hygiene products or even laundry detergents, allergies, hormonal changes after menopause. And even something like a forgotten tampon can cause changes in discharge.
Wait, a foreign object like a tampon. I have to ask, how does that happen? And what should someone do if they realize that's the case?
It's more common than you might think. And it usually happens if a tampon gets pushed too far up or forgotten during a period. If you realize you have a tampon that's been in for longer than recommended, it's super important to remove it as soon as possible. And if you're experiencing unusual discharge, especially if it's accompanied by a foul odor, don't hesitate to see a doctor.
Noted. It sounds like it's best to err on the side of caution. Now we've talked about what can cause these changes. But when do we absolutely need to see a doctor? What are those big red flags that shouldn't be ignored?
If you have pelvic pain, or discharge that looks like pus, fever, or blood in the discharge after menopause, those are signs to seek medical attention right away. And one more thing. If you ever notice stool in the vaginal discharge, that's another signal to get to a doctor immediately.
Okay, those definitely sound serious. But the good news is that most causes of abnormal discharge are treatable, right?
Absolutely. And that's why early detection is so important. Don't let fear or embarrassment keep you from getting the help you need. Your health is worth it.
I couldn't agree more. So we've covered what's normal, what's not, and when it's time to seek medical advice. But let's talk about prevention. The sources had some great tips on keeping our vaginal microbiome happy and healthy. What are some things we can do on a daily basis to keep things in balance?
First things first, gentle is the name of the game. When cleansing the vulva, that's the area around the outside of the vagina, stick to mild, unscented soap and water. And please ditch the douching. It messes with the natural balance of your vagina and can actually increase your risk of infections.
Ditching the douching. Got it. What else?
Wearing cotton underwear can be a game changer. Cotton is breathable and helps keep the area dry, which is important for preventing the overgrowth of yeast and bacteria. And of course, maintaining good overall hygiene, like wiping front to back after using the toilet, is crucial.
Okay, so gentle cleansing, no douching,
Yeah.
cotton underwear, and good hygiene. All simple things we can incorporate into our routines.
Exactly. It's about working with your body, not against it. Now remember, everybody is unique. So what's normal for one person might not be normal for another. Paying attention to your own body and its cues is key. What stands out to you as the most important thing you've learned so far?
Honestly, the whole microbiome thing blew my mind. It's fascinating to think that there's this whole ecosystem down there working to keep things balanced.
I know, right? It really highlights the incredible complexity of our bodies.
Okay, we've laid a great foundation. But I'm curious about something you mentioned earlier, how the amount and type of discharge can change throughout the menstrual cycle. Can you walk us through that in a little more detail? What kind of changes should we expect to see? And what do they actually mean?
Of course. It all comes down to the hormonal shifts that happen throughout your cycle. Right after your period, you might notice very little discharge. This is because estrogen levels are low. As estrogen starts to rise leading up to ovulation, you'll likely see an increase in discharge. It often becomes clear and stretchy, kind of like egg whites.
I've definitely noticed that egg white consistency around ovulation is pretty wild how our bodies give us these visual cues.
It really is, and it's all thanks to the rising estrogen,
Yeah.
which is helping to create a hospitable environment for sperm now after ovulation. As progesterone becomes the dominant hormone, the discharge tends to thicken up again and might turn a bit white or creamy.
So it's like a cycle within a cycle, reflecting what's going on with our hormones. Pretty cool.
Right. Our bodies are amazing. Now, keep in mind that these are just general guidelines. The exact amount and consistency of discharge can vary from person to person. But understanding these patterns can help you feel more in tune with your body and recognize when something might be off.
Totally. It's all about knowing our own normal. Now, I'm also curious about what happens during pregnancy. I know the sources mentioned that discharge can increase during that time. What's going on there? And are there any specific changes we should look out for?
Great question. Pregnancy is a hormone roller coaster, and that definitely impacts vaginal discharge. You'll probably notice an increase in discharge throughout your pregnancy, especially in the later stages. This is due to higher estrogen levels and increased blood flow to the pelvic area. The discharge is usually thin, white, and milky looking.
So more discharge during pregnancy is actually a good thing.
In most cases, yes. It's your body's way of protecting the baby from infection. However, it's still important to be aware of any changes that seem unusual. If the discharge becomes greenish, yellowish, or foul-smelling, or if you experience itching or burning, it's important to check in with your doctor. These could be signs of an infection.
So it's that same theme of paying attention to any significant changes and seeking medical advice if needed.
Exactly. Now, we've talked about the menstrual cycle in pregnancy, but there's another major life stage that can impact vaginal discharge: menopause.
Right. The sources mention that hormonal changes during menopause can lead to changes in discharge. What should we expect during this transition? And are there any concerns we should be aware of?
Menopause is all about declining estrogen levels, and that can have a big impact on the vagina. As estrogen drops, the vaginal tissues can become thinner and drier. This often leads to less discharge overall, which is perfectly normal. However, some women experience vaginal dryness, which can be uncomfortable and make intercourse painful.
Are there any remedies for vaginal dryness? It sounds like that could really affect a woman's quality of life.
Absolutely. There are several things you can try. Over-the-counter vaginal moisturizers and lubricants can help alleviate dryness and discomfort. And if those aren't enough, your doctor may recommend topical or systemic hormone therapy to restore moisture.
So there are options available. That's reassuring to know.
Yeah. It's important to remember that menopause is a natural transition, and there's no need to suffer in silence if you're experiencing uncomfortable symptoms. Talk to your doctor, explore different options, and find what works best for you.
I love that message of empowerment. We have more control over our bodies than we often realize. Now, speaking of taking control, the sources also touched on the importance of hygiene in maintaining vaginal health. They mentioned that certain practices can either promote or disrupt the delicate balance of the vaginal microbiome. Can you delve into that a bit more?
Absolutely. When it comes to vaginal hygiene, less is often more. The vagina is actually a self-cleaning organ. It has its own natural mechanisms for staying clean and maintaining a healthy pH balance.
So no need to go overboard with cleansing.
Exactly. In fact, excessive cleansing or using harsh soaps and douches can disrupt the natural balance, irritate the delicate tissues, and even increase your risk of infections.
So sticking with the gentle approach we talked about earlier.
Precisely. Mild, unscented soap and water for the vulva, the external area surrounding the vagina, is all you need. And remember, the vagina cleanses itself internally.
Our bodies are pretty amazing, aren't they?
They really are. Now, even though the vagina is self-cleaning, it's still important to be aware of any changes in discharge or other symptoms. If something seems off, don't hesitate to reach out to your doctor.
Got it. It's all about finding that balance between trusting our bodies and knowing when to seek professional guidance. Okay, we've covered a lot of ground so far. We've talked about normal discharge, abnormal discharge, the causes, when to see a doctor, and how discharge can change throughout different life stages. But before we move on, I want to circle back to something we touched on earlier, sexually transmitted infections, or STIs.
Right.
You're right, we need to talk about STIs. They're a common cause of abnormal discharge, and it's important to be aware of the signs and symptoms.
Yeah, definitely.
Exactly. So let's dive into that a bit further. Which STIs are most commonly associated with changes in discharge, and what should we be on the lookout for?
Some of the STIs that can cause changes in discharge include chlamydia, gonorrhea, and trichomoniasis. With chlamydia and gonorrhea, you might notice a yellow or green discharge that has an unusual odor. Trichomoniasis often causes a frothy yellow-green discharge that can also have a strong odor.
So these changes in discharge can be early warning signs of an STI.
Yes, they can be. And that's why regular STI testing is so important, especially if you're sexually active.
Regular testing. Got it. Now, I know this is a sensitive topic, but what about protection? What's the best way to reduce the risk of contracting an STI?
Using barrier methods like condoms during sexual activity is one of the most effective ways to protect yourself. Condoms act as a physical barrier, preventing the exchange of bodily fluids that can carry infections.
So condoms aren't just about preventing pregnancy. They're a crucial part of STI prevention.
Absolutely. And it's important to use them consistently and correctly every time you have sex to maximize their effectiveness.
Right. Now, let's say someone does notice changes in their discharge that are concerning. What's the best course of action? Should they wait and see if it clears up on its own? Or is it best to see a doctor right away?
If you notice any unusual changes in your discharge, like a change in color, texture, or smell, or if you experience any other symptoms like itching, burning, or pain, it's always best to see a doctor. They can examine you, determine the cause of the changes, and recommend the appropriate treatment.
So don't wait and see. Get it checked out.
Exactly. Early diagnosis and treatment are key, especially when it comes to STIs. Delaying treatment can lead to complications and increase the risk of spreading the infection.
That makes sense. Okay, so we've covered the basics of STIs, their connection to vaginal discharge, and the importance of regular testing and protection. But I want to shift gears for a minute and talk about the emotional side of things. I imagine receiving an STI diagnosis can be stressful, even embarrassing for some people.
Oh yeah, for sure.
You're absolutely right. There's a lot of stigma and shame surrounding STIs, and that can make it difficult for people to talk about them and seek help.
Wow.
It's crucial to remember that STIs are common infections, and anyone who is sexually active can contract one. So it's not a reflection of someone's character or cleanliness.
Absolutely not. It's simply a health issue that needs to be addressed with compassion and understanding.
I love that. We need to destigmatize STIs and create a culture where people feel comfortable seeking testing and treatment without judgment.
I couldn't agree more. And if you are struggling with the emotional impact of an STI diagnosis, reaching out to a therapist or counselor can provide valuable support and guidance.
That's such an important point. It's okay to ask for help and support during challenging times.
Okay.
I think we've given our listener a lot to think about regarding SPIs. Now, before we move on, I want to touch on one last thing related to vaginal discharge. Mental health.
Oh, interesting.
Mental health.
How does that relate to vaginal discharge?
Well, I was thinking about how much anxiety and stress can surround this topic. Feeling self-conscious about discharge, worrying about what's normal, maybe even feeling embarrassed to talk about it with a partner or a doctor. It occurred to me that all of this can take a toll on our mental well-being.
Yeah, you're absolutely right. The stigma and taboo surrounding vaginal health can contribute to feelings of shame and anxiety. It's important to remember that vaginal discharge is a normal bodily function, and there's no need to feel ashamed or embarrassed about it.
So talking about it more openly can help break down the stigma.
Exactly. Open communication, whether it's with your partner, friends, or doctor, can normalize these conversations and reduce feelings of isolation and shame.
And seeking professional help if those feelings become overwhelming.
Absolutely. Therapists and counselors are trained to help you navigate these challenges and develop coping mechanisms.
I think that's a really important point to emphasize. We focus a lot on the physical aspects of vaginal discharge, but it's equally important to acknowledge the emotional impact it can have. Feeling comfortable in our own bodies and having open and honest conversations about vaginal health is crucial for overall well-being.
Couldn't have said it better myself.
Okay, we've explored a lot of different facets of vaginal discharge. We've talked about what's normal, what's not, common causes, when to see a doctor, and even how to prevent issues. But I want to circle back to the vaginal microbiome for a moment. You mentioned earlier that it plays a vital role in maintaining vaginal health, but I'm curious to learn more about how it actually works. What exactly are these beneficial bacteria doing down there, and how can we support their growth and diversity?
That's a fantastic question. The vaginal microbiome is a fascinating world of tiny organisms that play a huge role in keeping things balanced and healthy. The star players are a type of bacteria called lactobacilli. They produce lactic acid, which helps to maintain the vagina's acidic pH. This acidic environment is key for preventing the overgrowth of harmful bacteria and yeast.
So it's like an internal defense system.
Exactly. The lactobacilli are like the gatekeepers, keeping the bad guys out and maintaining a healthy balance.
That's incredible. So how can we support the growth of these beneficial bacteria? I know we talked about ditching the douching, but are there any other lifestyle factors that come into play?
You bet. Diet plays a big role. Eating a balanced diet that's rich in fruits, vegetables, and fermented foods can promote a diverse and healthy microbiome throughout your body, including the vagina. There's also some evidence that probiotic supplements, specifically those containing strains of lactobacilli, can help to support vaginal health.
Probiotics for the vagina. That's interesting. I've definitely heard of probiotics for gut health, but I never really thought about them in terms of vaginal health.
It's a relatively new area of research, but there's growing evidence to suggest that certain strains of probiotics can be beneficial for the vaginal microbiome.
That's exciting. So eating a healthy diet and potentially considering probiotic supplements could be good strategies for supporting the vaginal microbiome, but are there any things we should avoid doing that might disrupt the balance?
Absolutely. We've already talked about the dangers of douching, but it's worth repeating. Douching washes away the good bacteria along with the bad, leaving your vagina vulnerable to infection. It's also important to be mindful of the soaps and detergents you use. Harsh chemicals and fragrances can irritate the delicate tissues and upset the balance of the microbiome.
So sticking to gentle, unscented products is key.
Exactly. Treat your vulva with the same care you treat your face. Choose products that are specifically designed for sensitive skin, and avoid harsh ingredients.
Makes sense. It sounds like it's all about listening to our bodies, being gentle, and making informed choices about the products we use.
Exactly. It's about finding that balance between supporting our natural defenses and seeking medical advice when needed.
Okay, we've covered a ton of ground today, from the basics of vaginal discharge to the intricacies of the vaginal microbiome. I feel like we've armed our listeners with a wealth of information.
I agree. I hope this deep dive has empowered our listeners to feel more confident and knowledgeable about their vaginal health.
Me too. But before we wrap things up, I wanted to touch on one more topic that often gets overlooked: the role of open communication in maintaining vaginal health. We've talked about the importance of talking to our doctors when we have concerns, but what about communication with our partners?
That's a great point. Open communication with our partners is essential for a healthy and fulfilling sex life. It's about feeling comfortable discussing our bodies, our desires, and any concerns we might have.
I couldn't agree more. So how can we encourage more open communication about vaginal health within our relationships? What are some tips for approaching these conversations in a way that feels safe and supportive?
Great question. First and foremost, it's about creating a foundation of trust and respect. Let your partner know that you value their input and that you want to create a space where you can both feel comfortable sharing your thoughts and feelings.
That sounds like a great starting point. But what about those awkward or embarrassing topics, like unusual discharge or concerns about STIs? How do we approach those conversations without feeling ashamed or judged?
It's all about approaching the conversation with honesty, empathy, and a focus on shared responsibility. Remember, your partner is likely just as invested in your health and well-being as you are. Start by expressing your own feelings and concerns in a non-judgmental way. You could say something like, "Hey, I've noticed a slight change in my discharge lately, and I'm feeling a bit concerned. I think it's important for us to talk about this together and figure out what to do." Approaching the conversation from a place of shared concern rather than blame or accusation can make a big difference.
That's a really helpful tip. So it's about being honest, empathetic, and approaching the conversation as a team.
Exactly. And remember, open communication isn't just about talking, it's also about listening. Be attentive to your partner's concerns and perspectives, and be willing to work together to find solutions.
This has been such an insightful conversation. I feel like we've covered so much ground and really explored the multifaceted nature of vaginal health.
I agree. It's been a pleasure diving into this topic with you and shedding light on this important aspect of women's health.
Me too. Now, before we wrap things up, I want to take a moment to acknowledge that we've been focusing specifically on the experiences of people with vaginas. But I also want to recognize that there are many different ways to experience sexuality, and that not everyone who has a vagina identifies as female.
That's an incredibly important point. Language and inclusivity matter, and it's essential to create a space where everyone feels seen and heard.
Absolutely. So while we've been using terms like women and vagina throughout this conversation,
Yeah.
we want to acknowledge that these terms don't encompass the full spectrum of gender identities and sexual experiences.
Right. Our goal is to provide information that is relevant and accessible to as many people as possible, while also being mindful of the nuances of language and inclusivity.
Well said. Okay, I think it's time to move on to part 2 of our deep dive. Are you ready to keep exploring?
Absolutely. Let's do it.
All right, we're back for part 2 of our deep dive into vaginal discharge. I feel like we've already covered so much ground, but there's still more to explore.
You're right. There's always more to learn. And speaking of learning, I want to pick up on something you mentioned earlier about the emotional side of vaginal health. We talked about the anxiety and stress that can surround this topic, but I think it's important to delve a little deeper into why these feelings are so common.
Absolutely. It's one thing to say that these feelings exist, but it's another thing to understand where they're coming from. So why do you think so many people experience shame or discomfort when it comes to talking about vaginal discharge?
I think a lot of it stems from societal taboos
Mm.
and the lack of open conversations about vaginal health. We're often taught from a young age that these topics are private, even shameful, and that can create a lot of internalized stigma.
It's like we're conditioned to think that anything related to our vaginas is somehow dirty or inappropriate to discuss.
Exactly, and that silence can be really damaging. It prevents us from seeking help when we need it. It makes us feel isolated in our experiences, and it perpetuates these harmful myths and misconceptions.
It's like a vicious cycle of silence and shame. So how do we break free from that? How do we start normalizing these conversations and creating culture where people feel comfortable talking about vaginal health?
I think it starts with education and open dialogue. The more we learn about our bodies and the more we talk about these topics, the less power those taboos will have over us.
I completely agree. Knowledge is power, right?
Absolutely. And it's not just about individual knowledge, it's about collective knowledge. When we share our experiences and information with each other, we create a sense of community and support.
It's like we're all in this together.
Exactly. And I think podcasts like this one play a crucial role in breaking down those barriers and fostering open, honest conversations.
I love that. It's amazing to think that we can use this platform to empower people and create positive change. Now, I want to shift gears a bit and talk about something that often comes up in conversations about vaginal discharge: hygiene. We've touched on the importance of gentle cleansing and ditching the douching, but I'm curious to learn more about the specific products we use. Are there certain ingredients we should be looking for or avoiding when it comes to soaps, washes, and even laundry detergents?
That's a great question, and it's one that I get asked a lot. The key takeaway here is to choose products that are gentle and pH balanced. The vagina has a naturally acidic pH, and using harsh soaps or detergents can disrupt that balance, leading to irritation and potentially increasing the risk of infections.
So how do we know if a product is pH balanced? Is there something specific we should be looking for in the label?
Some products will specifically state that they are pH balanced for the vagina, but that's not always the case. A good rule of thumb is to look for products that are fragrance-free, dye-free, and hypoallergenic. These are less likely to irritate the delicate tissues.
Okay, so gentle, fragrance-free, dye-free, and hypoallergenic.
Got it. Now, what about feminine hygiene products? There's so many options out there, from washes and wipes to sprays and deodorants. Are any of these products necessary for maintaining vaginal health? Or are they more likely to do more harm than good?
That's a great question. And honestly, it's a bit of a minefield out there. The truth is that most of these products are not only unnecessary, but can actually be harmful to vaginal health.
Really? Why is that? Well, as we've already discussed, the vagina is a self-cleaning organ. It doesn't need any help from these fancy washes, wipes, or sprays. In fact, these products often contain hard chemicals, fragrances, and antiseptics that can disrupt the delicate balance of the vaginal microbiome, leading to irritation, dryness, and even infections.
So ditching the douching is just the first step. We need to be mindful of all the products we're using down there.
Exactly. I know it can be tempting to reach for these products, especially when marketing messages try to convince us that we need them to feel fresh and clean. But trust me, your vagina knows how to take care of itself.
Our bodies are pretty amazing, aren't
They
they?
really are. Now, if you're concerned about odor or cleanliness, simply washing the vulva with mild, unscented soap and water is sufficient. And remember, it's important to wipe from front to back after using the toilet to prevent bacteria from the rectum from entering the vagina.
Got it. So when it comes to vaginal hygiene, less is definitely more.
Absolutely. Now, speaking of things we should avoid, I want to address a topic that often comes up in my practice: vaginal steaming. Have you heard of this trend?
Vaginal steaming, I've seen it pop up on social media, but I have to admit, I'm not entirely sure what it entails.
Essentially, it involves squatting or sitting over a pot of steaming water that's been infused with herbs. Proponents claim that it can cleanse the vagina, regulate the menstrual cycle, and even improve fertility.
That sounds interesting. But is there any scientific evidence to support these claims?
Unfortunately, no. There's no scientific evidence to suggest that vaginal steaming is beneficial for vaginal health. In fact, it can actually be quite dangerous.
Dangerous, how so?
The vagina is a delicate ecosystem, and exposing it to hot steam can disrupt its natural balance, leading to irritation, burns, and even infections. The steam can also alter the pH of the vagina, making it more susceptible to the overgrowth of harmful bacteria and yeast.
So not only is it ineffective, but it could actually make things worse.
Exactly, and it's important to note that the vagina is a self-cleaning organ. It doesn't need any help from external sources, especially not hot steam.
That's a good point. Our bodies are pretty good at taking care of themselves. So if we're not supposed to steam our vaginas, what are some safe and effective ways to maintain vaginal health?
We've already covered a lot of them. Gentle cleansing with mild, unscented soap and water, ditching the douching and feminine hygiene products, wearing breathable cotton underwear, and wiping from front to back after using the toilet. These are all simple yet effective strategies for supporting vaginal health.
It sounds like it's all about working with our bodies, not against them.
Exactly. Now, I want to address another topic that often comes up in relation to vaginal health: lubrication. We've talked about vaginal dryness as a potential side effect of menopause, but it can also be an issue for women of all ages.
Right. I know a lot of women experience dryness during sex, and it can be really uncomfortable. So what causes vaginal dryness? And what are some ways to address it?
Vaginal dryness can be caused by a variety of factors, including hormonal changes, certain medications, stress, and even just not being aroused enough during sex.
So it's not just a menopause thing.
Not at all. It's actually quite common, regardless of age. Now, if you're experiencing dryness, the first step is to figure out what might be causing it. If it's related to hormonal changes, your doctor may recommend topical or systemic hormone therapy. If it's related to stress or lack of arousal, focusing on relaxation techniques and foreplay can be helpful. And regardless of the cause, using a lubricant can make a world of difference.
Lubricant is a game changer, for sure. But with so many options available, how do we choose the right one?
That's a great question. There are two main types of lubricants: water-based and silicone-based. Water-based lubricants are generally the most versatile and compatible with condoms. Silicone-based lubricants tend to last longer and provide a more slippery feel, but they're not compatible with silicone toys.
So it's important to choose a lubricant based on your individual needs and preferences.
Exactly. And don't be afraid to experiment until you find one that works for you. Lubricant can make sex more comfortable and enjoyable for both partners.
It's all about making informed choices and prioritizing pleasure.
Absolutely. Now, before we move on, I want to circle back to something we touched on earlier: the emotional impact of vaginal health issues. We talk about how stigma and shame can prevent people from seeking help, but I think it's important to highlight the role that mental health can play in overall vaginal well-being.
That's a great point. It's all connected, isn't it?
It really is. Our mental and physical health are intricately intertwined, and vaginal health is no exception. Stress, anxiety, and depression can all impact our hormonal balance, our immune system, and even our vaginal microbiome.
So taking care of our mental health is just as important as taking care of our physical health when it comes to vaginal well-being.
Absolutely. If you're struggling with stress, anxiety, or depression, it's important to seek professional help. Therapy, medication, and lifestyle changes can all play a role in managing these conditions and improving overall health, including vaginal health.
It's all about finding that balance
Yeah.
and taking a holistic approach to our well-being.
Exactly. Now, I want to address a topic that can be particularly challenging for many women: vaginal pain during sex.
That's a topic that deserves more attention. It can be a really difficult and isolating experience.
It absolutely can be, and unfortunately, it's more common than people realize. There are many potential causes of vaginal pain during sex, also known as dyspareunia. It can be related to physical factors, like vaginal dryness, infections, endometriosis, or pelvic floor muscle tension. It can also be linked to psychological factors,
Mhm.
like anxiety, trauma, or relationship
So
issues.
it's not always a straightforward diagnosis.
Not at all. It often requires a multidisciplinary approach, involving healthcare providers from various specialties, including gynecologists, physical therapists, and mental health professionals.
It sounds like it's important to advocate for ourselves and seek help from a variety of sources if we're experiencing pain during sex.
Absolutely. Don't suffer in silence. There are treatments available, and you deserve to have a pain-free and enjoyable sex life.
That's such an important message. Now, before we move on, I want to address another sensitive topic that often gets swept under the rug: vaginal odor. We've talked about how strong or foul odors can be a sign of infection, but what about those times when we're just feeling a little self-conscious about our natural scent?
Hmm. It's important to remember that the vagina has a natural scent, and that's perfectly normal. However, I know it can be easy to get caught up in societal messages that tell us we need to be odor-free down there.
It's like we're constantly bombarded with marketing messages for products that promise to eliminate vaginal odor. But is that even realistic?
Not really, and honestly, it's not necessary. The vagina has its own natural cleansing mechanisms, and trying to eliminate all odor can actually disrupt its delicate balance.
So what's the best way to approach vaginal odor? Is there a healthy balance between accepting our natural scent and addressing any concerns we might have?
Absolutely. It's all about finding that middle ground. If you're noticing a strong or foul odor, that's definitely a sign to see your doctor, as it could indicate an infection. But if you're just feeling a little self-conscious about your natural scent, there are some things you can do to feel fresher without disrupting the vaginal microbiome.
Like what?
Washing the vulva daily with mild, unscented soap and water is a good start. You can also try wearing breathable cotton underwear and changing your underwear frequently throughout the day. And if you're concerned about odor during your period, using unscented pads or tampons can help.
Those are all great tips. It sounds like it's about finding a balance between hygiene and respecting our body's natural processes.
Exactly. Now, before we move on, I want to address another common concern that I hear from women of all ages: vaginal itching. It can be so uncomfortable and frustrating. What causes vaginal itching? And what are some effective ways to relieve it?
Vaginal itching is definitely something I've experienced, and I know it can be really bothersome. So let's break it down. What are the most common culprits behind that itchy feeling?
The most common causes of vaginal itching are yeast infections, bacterial vaginosis, and contact dermatitis. Yeast infections are caused by an overgrowth of a type of fungus called Candida, which is normally present in the vagina in small amounts. They often cause intense itching, as well as a thick white discharge that resembles cottage cheese.
We've talked about the cottage cheese discharge before. It's definitely a memorable image.
It is. Now, bacterial vaginosis, or BV, is another common cause of vaginal itching. It's caused by an imbalance of bacteria in the vagina, and it often causes a thin, grayish-white discharge with a fishy odor.
So if you notice a fishy odor, that's a sign to see your doctor.
Absolutely. Now, contact dermatitis is another possibility. It's an allergic reaction to something that comes into contact with the vulva, such as soaps, detergents, feminine hygiene products, or even lubricants.
So it's another reason to be mindful of the products we're using down there.
Exactly. Now, if you're experiencing vaginal itching, it's important to see your doctor to get a proper diagnosis and treatment plan.
That makes sense. Self-treating can be risky, especially if you're not sure what's causing the itching.
Exactly. Now, while you're waiting for your appointment, there are some things you can do to relieve the itching. Avoid scratching the area, as this can further irritate the skin.
That's easier said than done. Itching can be so intense.
I know, it can be really tough, but trust me, scratching will only make it worse.
Okay, no scratching. What else can we do?
Applying a cool compress to the area can help to soothe the itching. You can also try taking a lukewarm bath with plain uncooked oatmeal, which has anti-inflammatory properties.
Oatmeal baths. That's a great tip. I've heard of those for eczema, but I never thought to try them for vaginal itching.
They can be really soothing. And as we've discussed before, Wearing breathable cotton underwear and avoiding tight-fitting clothing can help to keep the area dry and reduce irritation.
Those are all great tips. Now, I want to touch on a topic that can be particularly challenging for new parents. Vaginal discharge after childbirth. I know the postpartum period is a time of immense hormonal and physical changes. So what can women expect in terms of discharge during those first few weeks after giving birth?
That's a great question. After childbirth, women experience a type of vaginal discharge called lochia. It's a mixture of blood, mucus, and tissue from the lining of the uterus. And it's the body's way of cleansing the uterus after delivery.
So it's kind of like a superpowered period.
You could say that. Lochia starts out bright red and heavy, but it gradually becomes lighter in color and flow over time.
How long does lochia typically last?
It can vary from woman to woman, but it typically lasts for 4 to 6 weeks after delivery.
So it's a significant amount of time. Are there any changes in lochia that would warrant a call to the doctor?
Absolutely. If you notice a sudden increase in bleeding, a foul odor, or large clots, it's important to contact your doctor right away, as these could be signs of infection.
So it's that same message of paying attention to any significant changes and seeking medical advice if needed.
Exactly. Now, it's also important to note that lochia can sometimes be accompanied by cramps, similar to menstrual cramps. These cramps are caused by the uterus contracting back to its pre-pregnancy size, and they're usually mild and manageable.
So it's a natural part of the healing process.
Exactly. However, if the cramps are severe, or if you're experiencing other symptoms like fever or chills, it's important to contact your doctor.
Got it. It's all about being aware of our bodies and trusting our instincts. Now, before we wrap up part 2 of our deep dive, I want to address a topic that often gets overlooked: the impact of exercise on vaginal health. We've talked about the importance of physical activity for overall well-being, but are there any specific benefits or risks associated with exercise when it comes to the vagina?
That's a great question. Exercise is generally beneficial for overall health, and that includes vaginal health. Regular physical activity can improve blood flow to the pelvic area, which can help to maintain healthy vaginal tissues. It can also boost your mood, reduce stress, and improve sleep, all of which can have positive effects on your hormonal balance and immune system.
So exercise can be a win-win for both our physical and mental well-being, which in turn supports vaginal health.
Exactly. However, it's important to be mindful of certain types of exercise that can potentially pose risks to the vagina.
Like what?
Activities that involve prolonged pressure or friction on the vulva, such as cycling or horseback riding, can lead to irritation, chafing, and even infections.
So it's important to listen to our bodies
Hmm.
and choose activities that feel comfortable and supportive.
Exactly. And if you do experience any discomfort or irritation after exercise, make sure to take a break, allow the area to heal, and consider adjusting your workout routine or equipment.
Those are great tips. Now, I want to touch on another topic that can be particularly challenging for women who are active: vaginal discharge during exercise. I know some women experience an increase in discharge during or after workouts, and it can be embarrassing and inconvenient. What causes this, and are there any ways to prevent it?
That's a common concern, and it's completely normal. During exercise, our bodies heat up and sweat, and that includes the vagina. Increased blood flow to the pelvic area during exercise can also contribute to increased discharge.
So this is just our bodies doing their thing.
Exactly. It's a natural response to physical activity.
Yeah.
However, if you're finding it bothersome, there's some things you can do to minimize it.
Like what?
Wearing breathable workout clothes made from moisture-wicking fabrics can help to keep the area dry. You can also try wearing a panty liner during your workouts to absorb excess moisture. And if you're experiencing heavy discharge, showering immediately after your workout can help to cleanse the area and prevent odor.
Those are all practical tips. It sounds like it's all about being prepared and finding strategies that work for you.
Exactly. And remember, there's no need to be embarrassed about vaginal discharge during exercise. It's a natural bodily function, and it happens to many women.
That's a great point. It's all about normalizing these conversations and breaking down the stigma surrounding vaginal health.
I couldn't agree more. Now, I want to touch on a topic that's often shrouded in mystery and misconception: the G-spot. Have you heard of it?
The G-spot.
Yeah.
Of course, it's one of those topics that gets whispered about, but rarely discussed openly. What exactly is the G-spot, and is it a real thing?
The G-spot is a purportedly erogenous zone located on the front wall of the vagina. about 2–3 inches inside. However, its existence and exact location are still debated among researchers and healthcare professionals.
So a bit of a mystery.
It is. Some women report experiencing intense pleasure when this area is stimulated, while others don't notice anything special.
So it varies from person to person.
Exactly. Now, if you are curious about exploring the G-spot, the best approach is to experiment with different types of touch and pressure during self-exploration or with a partner.
So it's about communication, exploration, and finding what feels good.
Exactly. Now, it's important to note that the G-spot is often surrounded by a network of blood vessels and nerves, so it can be more sensitive than other areas of the vagina. If you experience any pain or discomfort during stimulation, stop and try a different technique or position.
It sounds like it's all about being gentle, attentive, and respectful of our body's signals.
Absolutely. Now, before we move on, I want to address another topic that often gets overlooked: the role of pelvic floor muscles in vaginal health. Have you heard of these muscles before?
Pelvic floor muscles, I've heard the term thrown around,
Yeah.
but I have to admit, I'm not entirely sure what they are or what they do.
That's okay. The pelvic floor muscles are a group of muscles that support the organs in the pelvis, including the bladder, uterus, and rectum. They play a crucial role in bladder and bowel control, sexual function, and overall pelvic stability.
So they're pretty important.
They are. Now, just like any other muscles in our body, the pelvic floor muscles can become weak or tight. Weak pelvic floor muscles can lead to issues like urinary incontinence, fecal incontinence, and even pelvic organ prolapse. Tight pelvic floor muscles can contribute to pain during sex, constipation, and difficulty emptying the bladder.
So it's important to keep these muscles strong and flexible.
Exactly. Now, how do we do that? Well, Kegel exercises are one of the most effective ways to strengthen the pelvic floor muscles.
Kegel exercises, I've heard of those,
Yeah.
but I have to admit, I'm not entirely sure how to do them correctly.
That's a common question. The key to doing Kegels correctly is to identify the right muscles. Imagine you're trying to stop the flow of urine midstream. Those are your pelvic floor muscles. To do a Kegel, squeeze those muscles, hold for a few seconds, and then relax.
So it's like a mini workout for our pelvic floor muscles.
Exactly. You can do Kegels anywhere, anytime, and no one will even know. I recommend doing a set of 10–15 Kegels 3–4 times a day.
That sounds manageable. Now, what about tight pelvic floor muscles? How do we address that?
If you have tight pelvic floor muscles, stretching and relaxation techniques can be helpful. A pelvic floor physical therapist can teach you specific stretches and exercises to release tension in these muscles.
So it's like physical therapy for our pelvic floor muscles.
Exactly. And it can make a world of difference in terms of pain relief, improved sexual function, and overall pelvic health.
This has been such an informative conversation about the pelvic floor muscles. I feel like I've learned so much.
Me too. It's amazing how much these muscles impact our overall health and well-being.
Okay. I think it's time to wrap up part 2 of our deep dive. We've covered a lot of ground, from hygiene and lubrication to the emotional aspects of vaginal health and the importance of the pelvic floor muscles.
We've definitely given our listeners a lot to think about.
We have, but there's still more to come. Join us for part 3, where we'll explore the fascinating world of the vaginal microbiome in more detail, discuss some common misconceptions about vaginal health, and answer some listener questions.
I can't wait.
Welcome back, everyone. We're diving into the final part of our deep dive into vaginal discharge. I'm so excited to continue this conversation and explore some more nuanced aspects of vaginal health.
Me too. There's so much to uncover, and I think our listeners are really going to benefit from this knowledge.
I completely agree. Now I want to start by circling back to the vaginal microbiome, which we've touched on a few times throughout this episode. It's such a fascinating topic, and I think it deserves a little more attention. Can you remind us what the vaginal microbiome is and why it's so important for overall health?
Absolutely. The vaginal microbiome is a complex community of microorganisms, mostly bacteria, that live in the vagina. It plays a crucial role in maintaining vaginal health by protecting against infections, regulating pH levels, and even influencing our immune system.
It's like an internal ecosystem, right?
Exactly. And just like any ecosystem, balance is key. When the vaginal microbiome is in balance, it's teeming with beneficial bacteria, primarily lactobacilli, that produce lactic acid, keeping the vagina's pH acidic, and creating a hostile environment for harmful bacteria and yeast.
So it's like a natural defense system.
Precisely. But when this balance is disrupted, it can lead to an overgrowth of harmful microorganisms, resulting in infections like bacterial vaginosis or yeast infections.
That makes sense. So what are some things that can disrupt the balance of the vaginal microbiome?
Well, we've already talked about the dangers of douching. It's like using a fire hose to clean a delicate garden. It just wipes out everything, good and bad. But there are other culprits as well, including certain soaps, detergents, and feminine hygiene products that contain harsh chemicals and fragrances. Even antibiotics, while sometimes necessary, can disrupt the delicate balance of the vaginal microbiome.
It sounds like it's all about being mindful of the products we use and making informed choices. Now, I know a lot of women are interested in probiotics as a way to support gut health. Are probiotics also beneficial for the vaginal microbiome?
That's a great question, and the answer is yes. Certain strains of probiotics have shown promise in supporting vaginal health, specifically probiotics containing lactobacillus species, particularly Lactobacillus crispaceus and Lactobacillus rhamnosus, have been studied for their potential to restore and maintain a healthy vaginal microbiome.
So how do these probiotics work?
Well, they essentially introduce beneficial bacteria into the vagina, helping to crowd out the harmful microorganisms and restore the balance.
That's pretty amazing. So are probiotics something that all women should be taking?
Not necessarily. It's important to talk to your doctor before starting any new supplements, including probiotics. They can help you determine if probiotics are right for you and recommend specific strains based on your individual needs.
That's a good point. It's always best to consult with a healthcare professional before making any major changes to our health regimen. Now, I want to shift gears a bit and talk about some common misconceptions about vaginal health. I know there are a lot of myths and misinformation floating around out there, so let's debunk some of these myths and set the record straight.
I love that idea. There's so much confusion and misinformation surrounding vaginal health, and it's time to address it head on.
All right, myth number one, vaginal discharge is always a sign of infection. What do you say to that, expert speaker?
That's a big myth that we need to bust right away. Vaginal discharge is a normal, healthy bodily function. As we've discussed throughout this episode, it plays a crucial role in keeping the vagina clean, lubricated, and protected from infection.
Exactly. It's only when the discharge changes significantly in color, texture, or smell, or if it's accompanied by other symptoms like itching or burning, that it might signal an infection.
Exactly. Now, myth number two, douching is necessary for vaginal hygiene. What do you think, host speaker?
Well, we've already debunked that one. Douching is not only unnecessary, but can actually be harmful to vaginal health. It disrupts the natural balance of the vaginal microbiome, washing away the good bacteria along with the bad, leaving the vagina more vulnerable to infections.
You nailed it. Now, myth number three, the vagina needs to be tight for pleasurable sex. What are your thoughts on this one, host speaker?
This is a myth that's steeped in shame and unrealistic expectations. The vagina is an amazing organ that's designed to expand and contract, and its elasticity naturally changes over time. Pleasure during sex is influenced by so many factors beyond vaginal tightness, including communication, arousal, and emotional connection.
I couldn't agree more. Now, myth number four, vaginal odor is always abnormal. What do you say to that, host speaker?
Another myth busted. The vagina has a natural scent, which can vary depending on factors like our menstrual cycle, diet, and overall health. It's only when the odor becomes strong, foul, or fishy that might indicate an infection.
Right. Now, myth number five, menopause marks the end of a woman's sex life. What are your thoughts on this one, host speaker?
Oh, I'm ready to take this one down. Menopause is a natural transition. While it does bring about hormonal changes, that can affect vaginal lubrication and sensation. It doesn't mean the end of a fulfilling sex life.
Exactly. There are so many ways to maintain a healthy and enjoyable sex life during and after menopause, including using lubricants, exploring different types of touch and stimulation, and communicating openly with our partners.
I love that. Okay, I think we've successfully debunked some of the most common myths about vaginal health. I hope our listeners are feeling more informed and empowered to take charge of their vaginal well-being.
Me too. Now, before we wrap up our deep dive, I want to acknowledge that this is just a starting point. There's always more to learn and explore when it comes to vaginal health.
Absolutely. And I encourage our listeners to continue seeking information from reputable sources, talking to their healthcare providers, and, most importantly, listening to their own bodies.
Well said. Now, before we say goodbye, I want to address a few listener questions that we received on social media. Are you ready for some Q&A, host speaker?
Bring it on. I love hearing from our listeners and addressing their questions directly.
All right, question number one. I've heard that wearing tight jeans can cause yeast infections. Is that true?
That's a question I've wondered about myself. What do you say, expert speaker?
While tight clothing doesn't directly cause yeast infections, it can create an environment that's more favorable for yeast to grow, Yeast thrives in warm, moist environments, and tight clothing can trap heat and moisture, creating the perfect breeding ground for yeast.
So it's not the genes themselves, but the environment they create.
Exactly. Now, this doesn't mean you have to give up your favorite jeans. Just be mindful of how often you wear them, and make sure to choose breathable fabrics whenever possible.
That's a good point. Balance is key.
Mm.
Okay, question number 2. I'm experiencing vaginal dryness, but I'm not in menopause. What could be causing this, and what can I do about it?
Vaginal dryness can be caused by a variety of factors, even in premenopausal women, including hormonal fluctuations, certain medications, stress, smoking, and even just not being aroused enough during sex. If you're experiencing dryness, it's important to talk to your doctor to rule out any underlying medical
So
conditions.
it's not just a menopause thing.
Not at all. And in the meantime, using a lubricant can make a world of difference.
Lubricant is a great tool for addressing dryness and enhancing pleasure. Okay, question number 3. I'm concerned about the safety of using menstrual cups. Are there any risks associated with using them?
Menstrual cups are a safe and effective alternative to tampons and pads when used correctly. However, it's important to choose a cup that's the right size and shape for your body and to follow the manufacturer's instructions carefully.
So it's all about doing your research and being informed.
Exactly. Now, if you experience any pain, discomfort, or unusual discharge while using a menstrual cup, it's important to stop using it and consult with your doctor.
Always err on the side of caution. Okay, I think we have time for one more question. Question number 4. What are some tips for talking to my teenage daughter about vaginal health?
That's a great question, and it's so important to have these conversations with our daughters. Start by creating a safe and open space where she feels comfortable asking questions without feeling judged or embarrassed.
It's all about fostering that open communication early on.
Exactly. Use age-appropriate language and focus on the positive aspects of vaginal health, emphasizing that it's a normal and natural part of being a woman.
That's a great approach. It's about normalizing these conversations and empowering our daughters to take charge of their own health and well-being.
I couldn't agree more. Okay, I think that's all the time we have for listener questions today, but I want to encourage our listeners to keep those questions coming. We love hearing from you and addressing your concerns.
This has been such an incredible deep dive into the world of vaginal discharge and overall vaginal health. I feel like we've covered so much ground and hopefully empowered our listeners to feel more confident and informed.
I agree. It's been a pleasure sharing this knowledge with you and our listeners.
Thank you so much for joining us on this journey. Expert speaker, your insights and expertise have been invaluable.
It's been my pleasure.
And to all our listeners, thank you for tuning in. Remember, knowledge is power. And when it comes to vaginal health, there's no such thing as a stupid question. Keep learning, keep exploring, and keep advocating for your own well-being.
Until next time, stay curious and stay healthy.